Hey there, Jillian here. I am coming on today to talk a little bit more about my journey into a master's in marriage and family therapy, particularly as someone who did dentistry and then medicine and now is doing master's in marriage and family therapy. What the heck is going on? Well, that's an interesting question, but also I realize that many of you are considering the same. So I've had the opportunity to answer some of the questions one-on-one, but because I'm getting quite a few of them, I realized it might be meaningful and helpful to just make a video so that the people who are interested can come here for my answers and also to share your continued questions down below. And I'll continue to make videos so that we can have this resource, this discussion for others who are considering the same questions for their own life. So if you don't know my journey, I started my career fast tracking to become a military oral maxillofacial surgeon, realizing that that career was not the best fit for me at the time, and having a medical illness that nearly cost me my life led me to a transition into oral medicine. And if you want to learn more about that, you can check out the other video I have on the channel, several videos of all about that on the channel. Well, today we're going to focus more on the marriage and family therapy part because that's where y'all are asking me a lot of questions recently. But I did oral medicine, and in oral medicine, residents do a lot of focus with patients with head and neck cancer. So patients with head and neck cancer experience a lot of symptoms from their radiation treatment and their surgical treatment that can impact their psychosocial, psychospiritual well-being. I really valued the opportunity to serve these patients and felt that that was the focus that I really wanted to narrow my career on, because that was where I personally felt I could add the most value. I resonate a lot with their psychospiritual distress in the face of serious illness, but it wasn't the same of which I had navigated in my own life, so I didn't over-identify, but I craved the desire to be there for those patients. So when I focused my career on patients with head and neck cancer, I was trying to figure out what role I really wanted to play. And when I was in surgery, I always thought I was going to go back to residency to be a psychiatrist with a particular interest in consult liaison psychiatry and palliative care psychiatry. But when I was in surgical training, I developed suicidal ideation while on call. And I also had realized that I had sacrificed a lot of things that mattered to me because of the way that residency is. You know, it's often we get very limited time with our loved ones. And so I was having a lot of anxiety about applying to psychiatry this match cycle. And also, when I was really thinking about what I wanted to cultivate in terms of skills, I really wanted to cultivate psychotherapy skills. And I wasn't so interested in prescribing psychotropic meds, not because I have any bias against them, but because that just wasn't where I saw myself focused, at least at this time. I'm very curious about it. So I never say never when it goes to, will you apply to psychiatry in the future? Potentially. But at this point, this stage of my career, when I was talking to people about what I was interested in, which was really increasing my psychotherapy skills, increasing my understanding about how to support people with high levels of trauma and serious illness, and really considering the systemic components, I was introduced to marriage and family therapy. When I first heard about it, I thought, why the heck would I become a marriage and family therapist? I am not married, and my family refused to go to therapy with me. So why would I do that? But then when I thought about and read about the role of a marriage and family therapist and their construct that really focuses on the environmental impacts and doesn't make a person feel like they're individually to blame for what's going on, that really resonated with me, both from a personal standpoint, someone who almost died from anorexia nervosa and thought it was just my problem and that I was the burden, which is not true. And also seeing the impact of cancer on families. I knew, and also somebody who coaches people who are experiencing moral injury and burnout, and appreciating the systemic contributions of the impact on our wellness. It really felt like such a strong fit when I just separated myself from marriage and family therapy, the actual role of developing skills to understand environmental impacts and how to navigate those resonated, particularly after finishing a certification as a chief wellness officer, change management officer who considers, again, the systemic impacts on our well-being. So other considerations that I had when considering marriage and family therapy were go back to school to become a psychologist. And marriage and family therapy, you think about other counselors or a social worker and psychiatry. So the things I was really serious about were I kept looking for a PhD in psychology, psychiatry, and then this marriage and family therapy that came into my sight later. So reasons I chose marriage and family therapy, psychiatry was again where I thought I was going to go, but I was having a lot of physical symptoms when I was considering putting myself back into residency at this interval of time. I have a dog I love dearly. He would be 7 when I started residency, so I was thinking he'll be 11 when I finish, and I'm interested in consult liaison, so I might miss his whole life. I wasn't willing to do that. And again, sure, I know people can have dogs during residency, but if you understand the way that I live with my dog, he is numero uno. The quality of life I needed him to have was too high for what I thought I could give him while in residency. Not to judge people who are in residency. Again, I'm a single female. I don't have support other than what I would have paid for in order to get him the love and care he needed. But I had felt the regrets of neglecting relationships and the people I loved during my first residencies. So I did not want to do that. I was really nervous about going back on call because when sleep deprived, I really have a hard time with not having suicidal thoughts. And I wanted to prioritize self-compassion and my overall wellness, something I hadn't given myself permission to do before. So those factors came in when I was really considering, do I do residency again? And interestingly enough, I was quite confident I was going to apply to match before I knew about marriage and family therapy and the options that exist. With psychology, my major is in biology, my minor is in biochemistry. So I'd have to get some undergrad work done in order to be eligible to pursue higher levels of psychology. And from my experience of psychology, it is more individual focused. So again, marriage and family therapy, even logistics wise aside, was a better fit from a role perspective. But logistically speaking, marriage and family therapy honored my bachelor's in biology. My boss at the time of this decision went to Abilene Christian. He actually majored in psychology, and his wife went to Abilene Christian, and she is actually a licensed marriage and family therapist. And Abilene Christian University is in the state that I live in, and also is very similar to the type of school I went to for undergrad. So all of these factors really aligned, and Abilene Christian University made it very easy. I went to their open house, everything. They were very supportive in helping me gain the information I needed to make the decision. And I also am using military benefits. So when it came to student loans, this question comes up a lot. I actually paid off my student loans the traditional way, which was a lot. I had $300,000 about student loans I paid off. And I, like many, did not want to take out any more. So Abilene Christian University's program was approved for my military benefits. So I am using military benefits to help me to change this career that's a much better fit for my interests, for my well-being, and also is not a huge pivot, but it's more of an evolution of what I have been steering myself towards. I am really interested in psychosocial, psychospiritual well-being, helping people to live their best quality of life, their most meaningful life, their most purposeful life, to be in community, to be in connection, understand how our environment impacts us, to not take personal blame, but take responsibility for the things that are within our responsibility, but also to be aware of where our environment impacts us so that we can empower ourselves to navigate some of the obstacles that are both within and external to us. And for those who want to know a little bit more about the specific program that I am doing, I'm going to share those links down below. For individual questions, I love to answer those. I often will coach people if they are looking for more longitudinal types of discussions. If they're questions that I think can be generalizable, I'm happy to answer them in another video. Again, I make this video because I've realized there's a lot of physicians and dentists who are interested in psychology or interested in career pivots. They think that they've missed their opportunity to pursue something like this. maybe you haven't yet given them some self permission for whatever reason to pursue these paths. Another thing that comes up is often, I think for the most part, the individuals who have asked me these questions are already in coaching. So is it worth it to pursue further training if you are a coach with the belief that maybe you can't make a career of coaching? So that can be a limiting belief. I am continuing coaching. I am coaching healthcare professionals and also anyone who is in a point where they are in identity loss, oftentimes during life and career transitions. So if you're contemplating if you need this additional training, if you feel like you like coaching, but there's something missing, comment those questions and comments down below. We can have a little bit deeper dives into what's coming up for you. Because as a coach, I really enjoy aspects of coaching that it's not pathologizing. And I also felt that I desired more training for trauma and kind of understanding the fine line of where a person needs therapy and where coaching is appropriate. And I also think that many of us have some perceptions that may not be accurate. I might actually have those too about where you could take your coaching. There's a lot of trauma-informed types of coaching, and also from experts as where can coaching cause harm, especially if it's not trauma-informed. And I really, when I pursued my master's in marriage and family therapy, my track is the trauma track. And I really wanted to have a lot more insight as to where approaches that are often offered in coaching can be re-traumatizing. So from that perspective, you don't necessarily need to pursue another licensure track. There's more training for coaches that are out there that help to understand these questions. So if you are a psychologist, you are a mental health professional, you are a coach, these things come up, you have resources, please, I invite you to share those down below. This is definitely not meant to be a monologue and somebody that knows it all. It's someone who's talking this through together as we navigate both from a coaching perspective and someone who is pursuing the licensure track type of training in a mental health career. Some redundant things that I hear about coaching versus therapy is some coaches think that it might be easier to make a living going into therapy. I haven't been a therapist. I am training to become a marriage and family therapist. So, therapists, if you would like to weigh in about your perspectives about earning income as a therapist, if you're a therapist and a coach, I'd love you to also weigh in. I'm sure if you want to come on this channel and have a discussion, there's a few of you that we've already had chats that you will be planning to come on this channel, but please let me know. I would love to share more and more perspectives from people with experience on this topic. And let me know your stuck points, your thoughts, your comments. This is just the start of this discussion. And I just really wanted to touch base and let y'all know who have been reaching out that this is a discussion that I'm happy to have, especially if we continue to have it on this forum that we can bring people together who are interested in the same questions. And so I make sure I don't miss anyone's questions and have the capacity to answer them all. And as a coach, I'm never going to tell you what's best for you. So please don't take this as personalized advice. If you are seeking more individual support, I will put my coaching link down below without pressure, but just as an expectation that if you would want more personalized support, that would be the avenue that I would recommend if you are considering working with me on that. So until next time, friends, was this helpful? Did this answer some of your questions? Get some questions stirred up? Let me know down below. What I know for sure is that life is way too short to be living with a whole bunch of what ifs. What I know from recovering from near deathbed regrets is that I do not want to regret not pursuing things that I'm interested in on my deathbed as I did when I thought I might not be here anymore. And I'm going to share Matthew West's What If song down below to help you to consider what comes up for you and what do you want to do about it. So thank you for being here. If you enjoy this content, please make sure to subscribe, share it with anyone else who might benefit. I'd love to continue to build this community to support you every step of the way. So let me know who you are, share your thoughts below, and until next time, thanks for being here.